Hello everyone, how are you? Welcome to the PhysioBRAIN channel. This is Professor Gano, and today we're going to share a tip you can use to reduce your knee pain. So stay with me and don't miss these tips. You already know. Subscribe to the channel if you haven't already, like the video, and share it with anyone you think needs to know this information. So everyone, we've already given some tips on how to improve knee pain. And here we're going to teach you something really simple that can help a lot to reduce your knee pain. Okay? So many times we have knee pain for a variety of reasons and causes, right? But something we can do to improve the pain in our knees is what we call patellar mobilization, or in other words, moving the kneecap. Okay? So the patella is this little bone, right? This main bone that we have here in the knee, this bone which is movable, which can move, okay? And often there are adhesions, there are some complications, it becomes stiffer, it loses mobility, and this increases the pain usually associated with some other type of complication, okay? So what we often do for a painful knee, the physical therapy treatment, it involves patellar mobilization. So what you can do is, with your leg straight, right, completely relaxed, you'll notice that you can move it. You have to be very careful because this can cause pain depending on the condition of your knee, what your pathology is, what your disease is, what your complication is, okay? But try to notice that the patella moves, so try to find the pain threshold if you feel pain, okay? Try to make slow and gentle movements first, up and down, okay? And notice that your patella moves, and you can also move it from side to side. So you shift it to one side, then shift it to the other. And this, right, I've already worked with several patients who had degenerative changes or other types of complications in the knee. And with movement, with patellar mobilization, we were able to greatly reduce the pain because it started to move more, had more freedom, and this made knee movement easier. We were then able to do more exercises, which are the main focus of physical therapy. They are what will usually help you recover your movements, walk better, feel less pain, physical exercise, okay? So patellar mobilization can be used at certain times to make physical exercise easier. You loosen it up for movement, for exercises, all right? So you can work it from side to side, you can move it up and down, do some circular movements, depending on whether you don't feel pain there and if everything is okay, all right? So you can do these up and down movements 5 to 10 times and side to side 5 to 10 times. You'll notice that little by little it gets looser and there will be more movement, okay? You need to be careful, as we mentioned at the beginning of the video, so that there isn't too much pain, especially since some people have patellar instability, meaning the kneecap can become displaced due to ligament weakness or some other structure, okay? So you really need to be very careful. Always seek out a physical therapy professional so you can have proper guidance and recover your function as quickly as possible, all right? But I believe this video will help a lot of people reduce their pain, and I aim to improve their movement, all right? I hope you enjoyed the video. If you have any questions, write them in the comments, like the video if you haven't already, and share it with anyone you think needs this information. Take care, and I'll see you in the next video.